New York City is pioneering a controversial effort to combat the fatal opioid epidemic. Mayor Bill de Blasio announced that he will support a one-year pilot program of opening 4 overdose prevention centers across the city.
We lose people in their homes, in their basements, in the bathroom of a McDonald's or a Starbucks, alone with no help. That can't go on. And overdose prevention centers give us a chance to actually change that.
The overdose prevention centers are supervised injection sites where drug users can inject heroin under the eye of a medical professional who, if needed, can administer naloxone, a medication used to counter the effects of opioid overdoses.
Supervised injection sites are places where people can bring pre-obtained drugs and use them under medical supervision. And it's not just about a safe place to use, but also a place where people can get education on overdose prevention, on HIV or Hep C infection, and get connected to other care providers or social services that they may need.
In 2017, there were an estimated 1,441 overdose fatalities in New York City, making it the deadliest year on record. Weill Cornell Medical College estimated that the creation of 4 supervised injection facilities could prevent up to 130 overdoses and save up to $7 million in public health care costs annually.
I mean, we have 40 years of evidence that just say no, tough on crime approaches to drug use don't work. All it's led to is more mass incarceration, more overdose deaths, more potent drugs, and there's been absolutely no impact on the amount of drug use that's happening in our communities.
However, there are still major obstacles the city has to face in order for this to pass. City officials say the proposed plan would need approval from the State Department of Health, council members representing the sites, and an agreement from district attorneys to shield clients and operators from prosecution. While dozens of supervised injection sites exist in Canada and Europe, there are currently none with an official sanction in the U.S., though officials in San Francisco, Philadelphia, and Seattle have made moves to open them. Local supporters are hoping these sites will be up and running within 6 months.
There's still a lot of work still to be done about how we're going to establish supervised injection facilities in New York City, but one prerequisite to moving forward on that path was to get Mayor de Blasio on board and supportive. And so we're really pleased that the administration has come out in favor of these sites, and we look forward to working together to make sure that they're implemented in a way that is safe and healthy for people who use drugs.